Good afternoon and welcome back to another edition of the Lynn Lowdown. I'm Danni Vittori, the news director here at LCTV, and today we have Audrey Morse Gasteier, Chief of Policy and Strategy at Massachusetts Health Connector. She is currently on Zoom, so thank you for coming on the show.
Thanks so much for having me. It's great to be back.
Of course, thank you. And would you mind just saying a little bit about what Mass Health Connector is?
Absolutely. So the Massachusetts Health Connector is the state's official health insurance exchange or health insurance marketplace. And what that is a place where anybody who doesn't already get health insurance coverage, whether it's through a job or a program like Medicare, can come and enroll in affordable health coverage. Importantly, it's the only place in the state where you can qualify for subsidies or help lowering the cost of your health insurance coverage. And it's also the place where you can shop from all the state's health insurance companies to find the plan that's best for you and your family. So it's sort of a one-stop shop for health coverage here in the Commonwealth.
That sounds awesome. And I will ask, what is your role as Chief of Policy and Strategy?
Yeah, so I get to work on the design of health insurance coverage products that we offer to Massachusetts residents and work to raise awareness in the Massachusetts public about the health coverage options that we offer to residents here in the state. So we try to do work with community-based organizations to get the word out to people about how important it is to have health coverage, the fact that in Massachusetts, adults are required to have health coverage, and make sure people know about how affordable the options are for them, how much work we put into at a state and a federal level, making this health coverage affordable for people. And that, in fact, it covers all the needs you might have from a healthcare access perspective, and just giving people assistance for actually filling out those applications and getting enrolled.
Great, that's awesome. I did not realize adults were required to have health insurance. I actually did not realize that. I probably should.
That's true. Yeah.
And so you're here today to talk about special enrollment as opposed to annual enrollment. So you want to talk a little about that?
Absolutely. So every year we run something called an open enrollment period, and that runs from November 1st through late January. And that's the time of year when anybody can come in. They don't need any kind of a qualifying event or any special circumstance to enroll in coverage. So we do a lot of outreach. You hear a lot from us and about us at that time of year. But it's important for people to know that during the rest of the year, it doesn't mean that there's not ways to get into health coverage. So if you do have what's called a qualifying event or a life event, so that could be getting married, having a baby, you lost your job, those things can qualify you to enroll in health coverage at any time of the year. But there's also other qualifying events, including qualifying for our unique program, which is called Connector Care. And that's a program for people who earn up to about $41,000 a year for a household of one. A household of four would be about $83,000 a year. So people who are at that income level or below can qualify for Connector Care. And if they newly qualify at any time in the year, they can go ahead and enroll in coverage. So anybody can come to our website, which is www.mahealthconnector.org, and fill out an application. If they qualify for Connector Care, they can enroll for the first of the following month. But we also want to draw attention to the fact that a lot of people in that category qualify for free coverage. And that's anybody earning up to about $20,000 can qualify for a free plan, and they can go ahead and get enrolled any time of year. So it's just really important if people don't have health coverage, that they're not just waiting for open enrollment. There's a lot of ways to get into coverage the rest of the year. And what we find for a lot of people who don't have health coverage is they assume they won't be able to afford it. They think, oh, I don't have the money for that. It's hard to make ends meet right now. I'll get to that someday when my budget allows it. But in fact, most people who don't have coverage would qualify for free health insurance coverage or very low cost health insurance coverage. So that's what we're trying to spread the word about. Even during closed enrollment, there are these special enrollment triggers that allow people to enroll at other times of the year. So we do want people to check out their options. Come to our website, which is www.mahealthconnector.org.
Great, that's good. And that's definitely a good resource for people to know about. And another thing you'd mentioned was how much COVID had really affected people and caused special enrollment to become even more important than it already is.
COVID has affected, I think, a lot of the ways a lot of residents think about health insurance coverage, and it certainly affected the way we've tried to approach expanding health coverage here in the Commonwealth. So ever since the COVID emergency began back in March of 2020, we have been doing a number of extended enrollment periods wherein we allow people to get covered even outside of that open enrollment period. And no surprise, what we found is that there was a lot of different circumstances going on in people's lives. People were changing jobs, people were losing their jobs a lot at the beginning of the pandemic. And so all of that movement for people, changing employment situations and the like, and just, I think, developing a deepened appreciation for just how critical access to healthcare is, not just talking about vaccines, which anybody can get, even if they're uninsured, but all of the healthcare needs that we all need to be thinking extra hard about these days with the ongoing COVID dynamic and what we've all been through. So just doing all the work we can to make sure people understand where to come if they don't have health coverage and how to go about enrolling, and frankly, how much help there is to afford that coverage, to lower people's healthcare costs, and the help available to people to go through the application process itself. We have lots of organizations across the state to assist people who might want to sit down with a real life person and assist them in going through the application process. Right here in the Lynn area, we have the Lynn Community Health Center and Joint Committee for Children's Healthcare in Everett. Those are what are called navigators, which are trained organizations that are specially trained to assist people with the application process, understanding their options and getting into coverage.
Great, awesome. That sounds like a really good program you had. And you mentioned it a little bit before, but the best way to apply would be online through your website, or that would be the best way to contact you?
That's right. So the Health Connector has a website, which is www.mahealthconnector.org. And on that website, you can find all kinds of information about what you might qualify for. You can even get an estimate for premiums available to you in your area. And that's all available right there on that landing page. And you can also find links to local organizations that can assist you if you go to the Get Help button at the top of the page. So that's all there. And importantly, that is where you can actually fill out an application. If you go to our website, you can fill out an application for health coverage. But it's important for people to know they can reach us by phone. They can call us at 877-623-6765. And again, they can reach out to a local navigator organization in their area, and individuals there are trained to assist you with the application process and answer any questions you might have, and they can meet with you in person or over the phone. But there's a lot of ways to fill out an application and go ahead and get covered. And anybody who doesn't have health coverage should really do it and may qualify for something a lot more affordable than they might be assuming.
Mm-hmm. That's definitely good to know. I know a very common thing is how expensive health coverage can be, so that can definitely be a deterrent when looking at it.
Exactly.
And we'll ask, you're Massachusetts, so you're throughout the state. Why do you think it's so important for people in Lynn specifically to know about this?
Yeah, absolutely. It's a great question. So Massachusetts is really fortunate. We are the state with the highest level of health insurance coverage of any state in the United States. We've got about 97% of our residents covered at any given time. We're still working to get at that 3% of coverage. We really want everybody in the state to have health insurance coverage. It is so critical for people to have access to health care, to stay healthy, to help them if they get sick or have an accident. And that's not just important for people's health and their health outcomes. It's also important for their financial and economic protection. If something unexpected happens to you and you don't have health coverage, you could face really, unprecedented and overwhelming healthcare bills, and that can really rattle a household's finances, to put it mildly. So we want to make sure people have that protection. And one of the things we find when we think about that last 3% of the residents that we want to get into health coverage is that's not evenly distributed around the state. There are particular pockets of the state, particular cities and communities where we see higher levels of uninsurance. Lynn is one of those communities. So we know we have our work cut out for us in Lynn. And so if you are listening to this and you are one of those residents who may be uninsured, or one of your friends or family members or neighbors maybe, we are asking for your help to make sure we're getting everybody in Lynn covered. People in Lynn, just like all across the state, deserve to benefit from the health coverage investments that this state and country have made to make health coverage affordable. We want to make sure people have access to that care that they deserve and need. So that's why we're doing a lot of work in Lynn and communities like it around the state to try to raise awareness and make sure people know this is affordable and there's help available to get you into coverage with your application, help in all kinds of languages and all kinds of settings to make sure that you can get across the line and into that health coverage you need and deserve.
It's awesome. That's definitely a very good thing to know. And I want to make sure it's clear, probably for my benefit and everyone who's watching, is special enrollment is open throughout the year. Even if it says it's closed enrollment, there are still ways to get coverage.
That's exactly right. So any time of the year, if you qualify for our Connector Care program, so again, that's somebody earning up to about $41,000 a year as a household of one or a household of four, about $83,000 a year. And you can get into low dollar or free coverage with low copays and no deductibles. That's our Connector Care program that you can have a qualifying event for that all year long. But even if you're outside of that income range, if you have what's called a qualifying life event, have a baby, get married, change jobs, those things can qualify for a special enrollment period too. So whenever somebody doesn't have health coverage, we always say, just come check out your options. You may qualify for something. And we want to make sure we're getting people into coverage and they're not having to wait until November.
That does sound like a very important thing to be talked about. And I want to thank you again for coming on to discuss some of the options and making sure that it's really visible to the community.
Oh, absolutely. Thank you so much for having me on. I appreciate the opportunity to get the word out and hope your listeners and viewers at home will make sure they're covered, families covered, friends, neighbors, and members of their community. And I appreciate you helping us get the word out.
Yes. Of course. And so thank you again. And once again, my name is Danni Vittori. This has been another edition of the Lynn Lowdown. Come back next week for more guests.